Let's talk about pulp testing, a commonly misunderstood topic. Okay. Probably the most prevalent type of pulp testing is done electric pulp test. Okay. You just apply the device to the tooth, dial up the electricity coming out the end, or the charge, and either you get to 80 or 100 and there's no response, and then we know that all the tissue in the tooth is necrotic, or you get some response before the endpoint. All that tells you is some pulp tissue is alive somewhere in the tooth. It's a binary test result. Okay, we need something more nuanced than that. Okay, and if you have a multi-rooted tooth, useless. Useless in multi-rooted teeth, because you may have vital pulp tissue in one canal and necrotic pulp tissue in another canal, something in between, partially necrotic in a third canal, and you will get a vital response from electric pulp test. So what's a better answer? Better answer is thermal testing, and most people do thermal testing of mostly cold testing. Thermal testing is great because we're doing what the patient comes in and describes having occurred in their mouth. I drank a cold beverage and I had really severe pain that hung on and ached, or it came and it went, whatever, but it's usually something cold or something hot that sets it off, or something, you know, percussive. If they're reporting thermal symptoms in response to thermal stimulus, then we need to do the most accurate thing we can to reproduce their symptoms, and that would be provide the same stimulus. I would make a big statement here. It has to be sustainable. Okay? Without sustainability, thermal testing is extremely limited. You're going to put spray refrigerant on a cotton pellet, and every second you take that cotton pellet towards your patient's tooth, and especially after you touch that warm body temperature tooth, that cotton pellet is warming up every second until it reaches room temperature or body temperature. Huge variable. Heat testing, you heat a ball of gutta perch in a flame, that smoking thing, as it's coming towards our patient's tooth, is cooling off every second, and so as we test each tooth, we've increased the variables. And pulp testing is a really tough thing to do from the start, because we're testing and stimulating different teeth to see how they react, but we're asking for our patients to give us their subjective response. And everybody has a different pain threshold. Everybody describes these kinds of sensations differently. So we really need to remove all the variables we can. Again, sustainable sources of thermal stimulus take that variable temperature thing and eliminate it. So we're going to use ice for cold testing, and we're going to use an electric heat test. Okay, because when we put that on the patient's tooth, we park it on there and it's dialing exactly the same temperature as long as we hold it there. Now you're going to start finding pulps that are healthy and not healthy, and feel really confident about the information that you're getting. Cold testing with ice, can be with water, can be with carbon dioxide, make dry ice. The rationale for this is that it's colder than water-derived ice, and so that we'll be more easily able to test through porcelain, through acrylic, and I can't argue with that. I guess the reason that I still use water as my source of ice is because I'm getting the results that I need. It's so far superior to spray refrigerants that making the little ice pencil, we're going to make an ice pencil with an empty anesthetic carpule. And we're going to take the little plunger out, we're going to autoclave it, we're going to put a little piece of floss in there, We're going to put a bunch of these in the patient cup. You're just going to pull one out, put it in the freezer. After you put all these in the patient cup, the anesthetic carpules with the open ends up, you're going to put the floss in them. You're going to take a water syringe, fill them all up, put it in the freezer. When it's time to pulp test a tooth, you take one of these out. You're going to roll it between your hands to warm up the glass, grab the little floss, pull it out, and lay the ice stick on a 2x2, fold it over, and you have a perfect ice pencil that can test usually 3 or 4 teeth for some extended time. Cold test results, we need to be able to interpret them. Okay. Sharp, transient, meaning it goes right away. This is okay. We'd say it's probably reversibly inflamed, but it has a chance of getting better. Sharp, prolonged, different story. This is a dying pulp. Irreversible. Pulpitis. Okay, you need to do a root canal there. This guy here, we see this with exposed dentin. We see this with cracked tooth syndrome. We see this with glass ionomer syndrome. We see this with people with teeth that are just in that initial stages of inflammation. So let's look at heat testing. Sustainable source of heat testing requires an electric heat source. You can use a touch and heat. System B. Or an Elements. Obturation unit. These are all made by Cybron Endo. And they sell a heat testing tip that you put in each of these. You're going to put a little piece of gutta perch onto that. You're going to hit the on switch on the handle, and then once it's achieved heat and the gutta perch is malleable, you can go in and just test one tooth at a time. There is a bit of a latency to the responses, so if you test and take it off, don't go right onto the next tooth because there may be a bloom of heat response that occurs after you've taken the heat off the tooth. So what are we going to expect to see with these? If my cold test is normal limits and my heat test is no response, that's okay. Okay? Teeth aren't responsive to heat when they're healthy. If my cold test is no response or vague, and I haven't reproduced the patient's symptoms, I'm going to put heat on there. In this situation, probably will reproduce the symptoms. And with every diagnosis, reproducing the symptoms is the sine qua non. This is the gold standard. If we can reproduce the patient's symptoms when we're testing a single tooth, then we know for sure which tooth it is. Otherwise, we won't know because referred pain is very common. This is no response to cold, severe response to heat. That, and this may be a case that actually gets more comfortable with cold. That's a partial necrosis. A couple of other things I'd like to mention in terms of thermal testing. One is you do not want to rush in and test the tooth you suspect most first. If you go in there and you test that tooth first, your patient very likely won't know how to respond accurately to give you the data that you need, and it'll be a missed opportunity once you test it. With a cold test, there's a refractory period. You're not going to get the same test results afterwards. So we test sometimes on the opposite side of the arch. We test at least one tooth away from the one we suspect. We would go to the distally adjacent tooth, and last we test the one we most suspect because then we have a frame of reference over on the other side. We know it's not involved. We get their pain threshold, their response. As we get closer to it, we're going to get findings that help peel out the healthy from the unhealthy pulps. The other thing I would recommend is have your patients give you hand signals when they feel the onset of the symptoms or the response to the thermal test, and then you tell them, I will take the thermal stimulus off. Hold your hand up as long as you feel it, but as it drops, I want you to slowly, or whatever speed it goes away, I want you to drop your hand back to your chest. Having a graphical representation is easier for patients to share, impart. When you ask them to tell you when they're feeling a response, they keep asking themselves, like, is that it? Do I tell them now? Do I tell them now? Graphically, it's like you can draw a graph of their response and see the onset and the duration, which is what we're looking for. So, onset and duration. This is a cracked tooth. Onset, duration is short. Here's an irreversibly inflamed pulp. Onset is rapid and it's huge. It stays painful. Partial necrosis. If you put cold on it, here's the pain level when they walk in. You put cold on it, it will feel better. Put heat on it, it will feel worse. And it'll hang on and it'll ache.